It's about us and not for us. This is a really important place to start.
Patients need to be in the same places that our clinicians and our policy directors and our researchers are, as all of that evidence is being debated.
What we do is for patients, and that means we need to do it with patients.
You can't do this without patients.
We're doing this for patients.
We have so much to offer in terms of lived experience.
Patients are part of the health system. They should be seen as equal partners.
Patients have been involved in every aspect of the conference. We have them in the planning committees. We have them writing abstracts and proposing ideas for what's on in the workshops and the plenaries. We have them involved speaking at events.
If we can actually engage both our hearts and our minds in our decision making, then we will make the right decision.
If you exclude the patient, you'll be throwing darts at a whole heap of places and you might not even meet their needs. So always ask the person that's in need.
When there's a patient on a panel, the tone is different.
Making sure that we are not only listening to patients, but we are using that information to change the way we make decisions.
Government makes these decisions on behalf of patients, and so it's really important that they have a perspective and input.
Referring to the positive or the criticism at HTAi.
I think we should live what we preach. I think we should also have patients here to make sure that everything we discuss in context to the HTAi that they have the opportunity to give us feedback.
We've been working with patient organisations in our country to say, how do you think we should do this better?
There's a unique opportunity, particularly in Australia at the moment, given our review.
It's about being a part of something that shapes healthcare for Australia.
Only by incorporating all of those voices will we come up with a model that is sustainable in the long term.
I think it's really important that we widen our horizons and look across the globe, across the ditch, and actually look at the best ways to improve health technology assessment.
It is really important that we never lose sight of the fact that the outcome of a HTAi assessment is going to be life-changing.
Overall, it is important that we involve the patients in gatherings such as this, especially the ones with HTAi practitioners. These opportunities really help us HTAi agencies to better understand, revisit our process, and know how to keep our process really grounded and responsive to the needs of our patients.
Often it's the patients that are providing the narrative behind the data and filling the gaps of our current processes.
Today I had the pleasure of presenting on patient values and preferences in health technology assessment from the Canadian perspective.
Patients are important for HTAi for many different types of conditions, but they're particularly important for rare diseases.
It's important to bring patients into the fold because they're the ones who we're really trying to help.
I presented how our health technology assessment works in the Philippines, on how patients can do the topic nomination form and how are they being represented in the process.
It's really important that we be in the driver's seat with other coordinators and advisors in the continuing innovation of HTAi.
The benefit will be enormous and will be at close to 40 centres by the end of
One of the things that I loved the most was hearing about what patients had got out of coming here on a sponsorship as well, and just hearing them say how much they have learnt over the last couple of days, and to be able to make connections, to speak with people, to hear international experiences.
We're here to understand the HTAi process better and how we can improve, help to contribute to the HTAi review that's happening in Australia now. Very much here to learn about ways that we can contribute and how the whole system really works.
I wanted to understand the different perspectives, but I wanted to understand where things were tracking globally when it comes to seeing the true value of a medicine.
I want to have courage to change what I can change. So I came here.
I'm here to learn and be able to take that back to the people that I work with.
我今天做这个主题的分享呢，是因为我们在这本书里面学到，如果没有患者的参与，你就没有在做卫生技术评估。
What I'm here today is to learn more about what health technology assessment is about.
Seeing much more sophistication in the patient engagement in HTAi discussions, and that's across the board.
The patients have just been amazing at bringing their lived experience and their insights into the discussion.
Everybody talking to everybody. That's always the first step towards building solutions and creative outcomes.
I think everyone wants to collaborate. We need all stakeholders together.
Rare diseases still pose a huge challenge, and that there are opportunities here for collaborations with different stakeholders to join together.
Having the opportunity to come here and really start to understand the perspectives of all the stakeholders, to really get to know the process.
It's important to capture these perspectives in all sessions, in all possible ways.
This is an incredible opportunity for all of us to sort of share best practices and frankly worst practices. We can all take back to our own jurisdiction. So I think we can all raise each other's boats in that respect.